3 years ago today, the Center for Disease Control issued new guidelines for COVID-19. They recommended all people in the U.S. start wearing a mask whenever we were outside our homes. That was only a few weeks into the pandemic, but it would be several more months until Oregon and Washington instituted their own mask mandates. We've come a long way since then, and today the last mask mandate in both Oregon and Washington was lifted. Now you no longer need to wear a mask in most healthcare settings. Plenty of you are happy about that, like Veronica, who wrote to us to say, "I think it should be left up to the individual. I'm so sick of masks and not being able to see the face of my medical provider. I personally am so ready to throw my masks in the garbage." But don't throw all your masks in the garbage just yet, Veronica. You may still need them for certain situations. We reached out to major healthcare systems in Oregon and Washington to find out whether masks will still be required. If you come in with COVID or cold flu symptoms, then yeah, they're going to ask you to wear a mask. Along with many emergency rooms, and some hospitals are still requiring masks in behavioral health units and maternity wards. You'll also still have to wear a mask in high-risk areas that include areas where cancer patients are being treated, like infusion centers, dialysis units, radiation, and oncology clinics. That sort of all makes sense, doesn't it? It's because those patients are high risk and many are immunocompromised. We heard from one viewer who was nervous about the mandate being dropped for people like her. Jennifer wrote in to say, "Terrified. Absolutely terrified. I'm immunocompromised and handicapped. Now the one place disabled and immunocompromised people have to go and was safe will be anxiety-inducing." Well, all the hospital systems that we heard from are still highly recommending that all patients wear masks in all settings. And many of them say that if you, the patient, ask your provider to wear a mask while they're treating you, they will. Here's Terry Dantzler with Portland Urgent Care.
We did have a discussion when we found out this was going to be an option, and we wanted to be sure that all of our patients stayed safe and be respectful of others. So we decided that if you come in and you have cold symptoms or a cough, that we're going to continue to require that patients wear a mask. So to me, that's just common sense now that we've been wearing them for so long and we understand that it does help.
Yeah, absolutely. I didn't get a cold last year. I don't know about you. I did get COVID, but I didn't get a cold. Dantzler's hoping that mask wearing when you're sick, both in and out of healthcare settings, becomes more common in the coming years.
It is very common sense to have people wear masks when you're not feeling well. Whether you are coming to an urgent care, the hospital, the grocery store, it'd be really nice. It would be really nice to be respectful of other people in their space.
That seems to be something that many people are considering, like Terry, who wrote, "Because of the habit of wearing a mask whenever I am in a large group of people, it's been 3.5 years since I've had a respiratory infection. I like that. I plan to continue wearing a mask whenever I am in a crowd of strangers." What about you? What are you going to do? You're going to continue to wear a mask in certain situations? What questions do you have about mask rules in healthcare? Send us an email. The address is thestory@kgw.com, or leave us a voicemail, 503-226-5090.